India continues to battle a growing coronavirus emergency. More than 45,000 new cases have been reported, its biggest daily jump. The country is now dealing with more than 1.2 million cases. And most are centered in the states of Maharashtra and Tamil Nadu, as well as Delhi. Uttar Pradesh and Gujarat also have high caseloads. Now, Neha Punya joins us live from New Delhi right now. Neha, so coronavirus cases and deaths, they're rising every day, but the World Health Organization is actually praising India for its efforts to fight the virus. Tell us, what is India doing right and what is it lacking in?
From the word get-go, Glenda, the WHO had praised India for implementing an early lockdown back when it only had 500 cases, saying that this helped prevent a mass breakout and saved millions of lives. It's also praised Prime Minister Modi's government for, since then, building up the healthcare capacity in the country and relaxing lockdown restrictions in a phased manner. It's also said that the way India has ramped up its indigenous testing capacity is also something that's worth noting. But what hasn't worked in India's favor is that a lot of this healthcare capacity is patchy. Urban centers like Delhi and Mumbai, bigger cities, have access to more testing kits and healthcare facilities, but it's not the same story in rural and semi-urban areas. The other question, of course, is that India is a massive country with a population of 1.3 billion people, which makes testing more people next to impossible at the current juncture. And of course, the other concern is that, like you said, the pandemic is playing out differently in different regions of the country, which requires a different strategy, the WHO says, from the Indian government.
Neha, there have been some interesting findings in Delhi with this serological survey. Can you tell us what that survey does and why the authorities want to do more of these surveys, evidently?
That's right. This survey was conducted in the last week of June, and the idea was to find out how widespread the outbreak here in the national capital was. And the findings have shown that 23% of Delhi's population has been impacted by COVID-19. This means 1 in 4 people likely had coronavirus and have now developed antibodies against this virus. This has led to many concerns because, as far as the government data is concerned, it shows that Delhi's positivity rate is 14%. But this statistic tells you that the outbreak is clearly a lot larger than the government has been able to identify, primarily because a lot of the people who possibly had COVID-19, the government says, are asymptomatic. It's also led to concerns about the possibility of community transmission already starting here in Delhi. And the government says the idea is to do more surveys. The next one will be done in the first week of August, and the idea the government says is to ramp up sampling. For the first survey, only 21,000 people were tested. The government says it will do more such tests with a bigger sample group in the future, because that will give it a true sense of how widespread COVID-19 is, at least here in Delhi.
Neha, thank you very much for that. Neha Punya there, speaking to us live in New Delhi.